impressions are priceless.
I'm Dr. Kenny Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.
Hi, I'm Dr. Kenny Levine. Welcome to Health Talk. Health Talk is a show about your total medical, physical, psychological wellness from the top of your head to the bottom of your feet. I'm a dentist. I'm a periodontist. I treat gum and bone disease. We do cosmetic procedures in the mouth. I do dental implant procedures. My patients range in age from 3 days old to 100, and we do a variety of procedures for them. You know, dentistry has changed. The dentistry of today is not the dentistry that your parents experienced. It's not the dentistry that your grandparents experienced. With the advent of bonding and veneer materials, your restorative dentists are able to create beautiful teeth. When a patient today is missing one, some, or all of their teeth, they don't have to wear dentures. They don't have to have their adjacent teeth ground down for caps and crowns. The most conservative thing we can do today is to build bone and gum tissue, and they can have a dental implant. Dental implants function like natural teeth. When they support dentures, they make a stable prosthesis out of a denture that used to be loose. Our patients are able to function with comfort and complete confidence. You know, in South Florida, many of our senior citizens, unfortunately, are single. When they go out on their dates, and a lot of our social life revolves around eating, they don't want their date to know that they don't have teeth. So if they are uncomfortable with their dentures, they don't have the self-confidence when they have to get up and excuse themselves from the dinner table to go in the restroom to clean out from under their dentures. It's not a very exciting or romantic thought for them. So with dental implants to stabilize dentures or to replace missing teeth, they're able to function. They can have dinner, they can go out and socialize and do dancing and whatever they do afterwards, so their life is complete. You know, traditionally they thought that a periodontist would treat older patients. In my practice today, we have a tremendous variety of patients of all ages. I mentioned infants. We are seeing patients from lactation consultants. Our youngest patient to date, I think, was 3 or 4 days old, who came directly from the hospital. The lactation consultant recognized that the infant was having trouble nursing, latching on, so the mother was not able to nurse the baby properly. So we have a procedure whereby we can use our laser with no anesthesia, no injections, no stitches, and we can relax the pull on the muscle, and the mothers go into the room with the baby alone. They come out 10 minutes later and say, the famous quote is, "He can nurse now." So for us, it's one of the most exciting and most rewarding and immediate gratifications that we have. My staff and I love seeing the babies coming in. At the other end of the age spectrum, we treat patients and adults of all ages. I was referred a 87-year-old gentleman who happened to be the uncle of my orthodontist friend, and he had been wearing a lower denture forever, and it had destroyed the bone on his teeth, and we were able to place in his mouth just 3 dental implants, and it was able to stabilize a denture for him so he was able to eat and function properly. I actually began my implant career in 1985 with my wife's grandfather. Grandpa was 85 years old in 1985, and he had been wearing dentures forever and couldn't eat properly. He was losing weight. I came back from my first implant course and placed just 2 implants in his mouth, and we were able to stabilize his existing denture. And those implants and Grandpa's denture lasted until he passed away many, many years later in good health and nutrition. So it's a wonderful, life-changing event for our older patients. Patients today want to keep their teeth. My goal as a periodontist is to keep people's teeth in comfort, function, and good aesthetics for the remainder of their lives. That's my primary goal. If for some reason teeth can't be kept, we have wonderful options in order to help them replace missing teeth. Now, that's the case whether somebody's missing a tooth for decades, or they're missing a tooth for just a couple of years, or they're told they're going to need to have teeth replaced. So we're able to replace those teeth with fixed appliances, and we can build bone and gum for them. You know, years ago, patients were told they weren't a candidate for dental implants. Their bone was too skinny or their sinuses were too big. Today, we have ways of correcting that. With growth factors, we can build bone almost anywhere. We can build bone height, we can build bone width, we can regenerate lost gum support. And in those cases, it takes many times more than one procedure to get it accomplished. But as one of my teachers said, we perform one miracle at a time and with great comfort. We're going to be back in a couple minutes. We're going to talk about another type of surgeon. I'm Dr. Kenny Levine, here with Health Talk. Thank you.